Hello, good people. Welcome to the Save Happy Life channel with me, Dr. Rose M. All visitors at Dr. Rose Counseling Services in Juja. Or you can call us on 0722 562 557. Today we are going to talk about an interesting topic entitled hallucination. What comes to your mind when you hear the word hallucination? Do you associate it with yourself, or you can only attribute it to other people? Let's delve into it. Hallucination is having a false perception of something that involves your five senses. Something that you feel is there, something you see it's there, but it's actually not there. So what are the various types of hallucination? Number one, we have the auditory hallucination. This involves hearing. When you hear sounds, voices, music that are not there. Number two, we have visual hallucination. When you see objects, animals, name them, that are not there. Number three, we have tactile hallucination. When you feel things are crawling, creepy crawlies are walking over your body and nobody else can see them. Number four, we have olfactory hallucination, and this involves smelling odors, smelling smells that are not there, that don't exist. Number five, we have the gustatory hallucination. This involves tasting flavors that are not existent. Tasting things that are not actually there, strange things and pleasant things that are not actually there. Then we have another interesting one, proprioceptive hallucination, where you feel like your body is floating or like you're flying. And the last one, number seven, is presence hallucination, where you feel like there's somebody in the room and you can feel it, but you can't see them. What causes hallucination? Hallucination is caused by broadly three things. We have the psychotic disorders. This is the schizophrenia spectrum of mental disorders. Then we have number two, we have the neurological conditions such as Alzheimer's and related neurological conditions. And then we have the more maybe common ones, other that are not very serious causes, but serious because they cause hallucination, where people who are using drugs and alcohol, people on very high fever, people with severe dehydration, people with sleep deprivation, people who have severe pain, people who are going through heavy trauma, people recovering from post-surgery and some medical drugs, and also depression. This longer list of other causes is more common and causes less permanent hallucination, and unlike psychotic and neurological causes. So what to do when you get hallucination? First, take a moment. If you have if you're listening to me, it means that you have relatively stable mental health. So take a moment and self-assess yourself and try to assess the underlying cause and address it. Is it stress? Is it sleep deprivation? Is it drug and alcohol? Assess yourself and address that cause. Then the other thing is patients with psychotic disorders, neurological disorders, kindly let them see a doctor when you realize that they are going through some hallucination episodes. And number three, be calm, and get something to distract your concentration on the source of your hallucination. And most importantly, please seek professional help. It may be not very serious hallucinations, in which case you can seek a professional psychotherapist or medical help so that you're given the proper medication to address that hallucination. Thank you very much for being with me. Until next time, bye-bye.